Does your diet have an impact on hypertension?
Absolutely. It definitely does. That's again another loaded question because it can affect due to several factors. Now, whenever you talk about diet and hypertension, what's the first thing comes to your mind? Salt. Am I right? There are certain people the salt is bad for them. There are other certain people it doesn't affect them. So you have certain patients you just take, even if they take a pinch of salt, their blood pressure will probably go up 40-50 points. And there are certain people who just put all the salt they want, it doesn't affect their blood pressure. So it again depends on their genetic makeup. What kind of genes do they have and what is their cause of their hypertension? I've literally seen people who hardly touch salt. Maybe they have had one salty meal, little bit. Next minute the blood pressure is skyrocketing. Okay. Now some other people do all the salt and nothing happens. But more importantly, how does diet affect, in my opinion? Let's forget about salt for a second. Salt is simplified, Either you're salt sensitive, you're not salt sensitive. Similarly, what drugs do we use for hypertension also? And that also dictates. If you have a salt sensitive person, you use a different kind of drugs. If you have a salt insensitive person, you use a different kind of drugs. You just don't take a drug out of the shelf and just treat everybody the same. So that's why I really focus on personalized treatment, if you really look at it. So going to the second part, how else can diet play a huge role with hypertension? Sure, if you don't pay attention, forget about the salt. Okay, I'm going to stay off salt. I'm going to have like a dozen donuts every morning, right? What's going to happen? You're going to gain weight. What's going to happen? You gain weight, you put more pressure on your system. What's going to happen? You're going to have high blood pressure. Pretty soon, most of the people who are overweight end up having hypertension some way or the other. Eventually, or will happen. You're putting so much strain on the body and it just goes on. So no matter what happens. Unless you are how can I put it, abnormal gene which causes obesity and you go to the gym and trying to work out and still, and you get your blood pressure down or things like that. Why do I say it that way? Because I've seen a lot of patients who have hypertension and who are significantly overweight. And the minute they lose even like 20-50 pounds, I have to stop blood pressure medicines. I had a gentleman who lost so much weight, he was on 4 blood pressure medications. I had to get rid of all his blood pressure medicines. Because if I gave him blood pressure medicines, he will pass out because blood pressure went so low. So yes, diet in all different ways, it can affect blood pressure, but it's just not salt, So you eat more red meat, more fatty stuff, more stuff. If you have more atherosclerosis build up, that's going to cause blood pressure to go up as well. In a nutshell, yes, diet will affect blood pressure, but in so many different ways. Does that answer your question?